Yes. Hi, everyone. Oh. Yeah, I hope nobody gets dizzy. Am I live? Is anybody with me? I don't know how to tell even if that was the case. Yeah, I think we are live. You guys can see all my secrets here, what I'm doing. I am Julie Shindler Cohen from Acupuncture and Integrative Medicine. Oh, it wants me to go upside down. I hope you guys don't mind. All right. Here with you today from home, as I think we are all home. Thank you. And I'm excited to be here today because we're all home, I think, or many of us are home, and I can only speak for myself that it's weird to be home, all right? I'm sure it's weird for everybody to be home. And I can speak on behalf of everybody in our offices that we miss you. We miss everybody. We miss seeing our patients. I was just talking to Jennifer Pillow, who works on Saturdays, and then Kat, who works on Saturdays. And it was just so weird to get up in the morning and not go to work on Saturday, right? That was just weird and wrong to not go to work on Saturday. I've also learned a thing or two about Facebook Lives. Watching some, that's weird when there's silence. Stand up a little higher. I can't, it's on my iPad and I can't, oh, maybe I'll do it. Bear with me. Baba, can you give me some books?
What?
Books.
Like what books?
Any books. Doesn't matter which books.
Can I get the ones that Nana gave you?
That's good. Anyways, I wanted to come on today. Pardon our technical difficulties. This is just crazy. To talk to you about Chinese herbs. I feel like I talk about that a lot in our practice. Thanks, Bubs. That's good. I talk about herbs a lot because they're so helpful. I often call them homework in Chinese medicine because we send people home with herbs oftentimes. Go get me some more books, please. Any books. We send them home with our patients, but it's really exciting now because, as you know, what we're dealing with, this virus began in China, and in China they have Chinese medicine, and they use Chinese medicine. So let's talk a little bit about Chinese medicine and herbs, how they work in general and what they do, and how we deliver them. So I'll remind you, and I will remind everybody that acupuncture and Chinese medicine, thank you, is a different kind of medicine, right? We diagnose differently. And when you come in for acupuncture and Chinese medicine, we treat you based on your Chinese medical diagnosis. Thank you for coming in. So I want you to forget everything you know about when people get sick. They get, as you say, a virus, as we say, a virus, or we get pneumonia, or we get a cold, or we get the flu. In Chinese medicine, that's not how it works. You get an invasion. We talk so much about immunity, and that's what the Chinese have been saying for thousands of years, and we still talk about immunity. It comes from your digestion, right? The point is, our ability to have immunity and fight off infections is dependent upon your digestion and the quality of energy that you create. We have something called Wei Qi, which is our most defensive external, it's our defense. So if you're prone to getting sick, it's because your Wei Qi, your defensive Qi, is lacking or it's deficient. So we want to support your defensive Qi. So first that starts with your digestion, because that's how we create Qi, and then you want to support your Wei Qi. So you want to strengthen it, and usually we use herbs that tonify the Qi. So herbs are classified by category. There are different categories of herbs. Thank you. And so there are herbs that tonify the qi. There are herbs that tonify the Chinese idea of blood. And then there's herbs that drain toxicity or drain damp. And so when formulas are created from thousands of years ago in modern times, they use a combination of these herbs to achieve a goal. So you might want to support your qi, but you also want to drain some toxicity. And so that's how we choose our herbs. And Chinese herbs are not given singularly. So we don't give one herb. We don't give just astragalus. We don't just give ginseng. We use combinations of herbs that are thousands of years old to achieve the goal. So, I say so a lot, I'm sorry. So we give herbs to support the overall system. And then the cool thing about Chinese herbs is, one of the many things, is that it can treat individual people uniquely. So it's not like we give one formula for everybody who fits this category. We choose our herbs based on the presentation. So for example, somebody comes in, they say, I have a cold. That can mean a lot of different things, right? So somebody with a cold can have a fever, they cannot have a fever. They can be hot or they can be chilled. And these nuances is really important to understand in terms of what we choose and how we choose it. So when people want to come in for immune support, we have to ask a few questions because not everybody's immune system is the same. We have to understand their history of how they've gotten sick in the past, how they get sick now. And when they get sick, we need to know specifically their symptoms. So that's how it works. I'm home. I'm sure we all know that we're home. And I have company at home. So there's a lot of different ways to give herbs. And please, if anybody has a question, please don't hesitate to write and I can see the comments and I'm happy to answer any questions. So I wanted to share with you, there's a few ways of giving herbs. One, and the most popular way of giving herbs is with pills. So right now, this is what my family and I are taking to kind of ward off some stuff. Another way to give herbs is in tinctures. And a lot of our patients are familiar with this because we have a lot of tinctures in our office. I miss you too, this is crazy. So when we give people tinctures, they're alcohol-based formulas. So people typically take drops of these into boiling water and they drink it down a couple times a day. So I like this better personally. It doesn't taste great. Whenever we've given tinctures to people in the past, they say, oh, it's like a tea. And it's a tea in the sense that you drink it, but it's not so delicious in that like you sit and enjoy a cup of tea. And that's because herbs have tastes and temperatures, mainly tastes, because tastes have functions. So sweet herbs support energy, bitter herbs drain. Herbs that we give to get rid of that wind, those invasions are usually acrid or spicy. So when you taste a formula, how it tastes is what it's doing. So tinctures are so much better than granulars. Yeah, that's what Michelle just said. So granulars are powder, which I meant to bring up that I didn't. It's a powder that people mix in water and drink down twice a day. There's more you have to get down with granules. You have to have more quantity of fluid to take in, but they can be really nice. The reason I usually like granules in the past is that I can modify, which means that we take a classical formula, but then we make additions, which is really nice because in Chinese medicine we come up with that diagnosis, but it's not, nobody's just one thing and not anything else. So we might give the base formula what the person's pattern is, but then we might want to add other things in. So granules are nice to do that because then we can modify. So another cool thing that I wanted to talk about is in Chinese medicine, root and branch, which is really cool. The idea in Chinese medicine is that when we have an imbalance, when we get sick a lot, or when we have hormonal imbalance, or when we have headaches, that's the branch. That's what it looks like. That's how it's manifesting. But the root is why it's happening. So if somebody's really uncomfortable, if somebody's really sick with a cold, whatever, we want to treat the branch. We just want to make them feel better. But ultimately, we want to get to the root of the problem, right? We want to support the digestion. We want to support what we call the spleen's energy, so that it doesn't happen again. So you're not getting sick. Another cool story I was thinking to share is that in traditional Chinese medicine, thousands of years ago, every Chinese family, they said, had an acupuncturist, herbalist on staff, and then they would stop paying him when somebody got sick because he wasn't doing his job, which is kind of cool. It's not the way we think about stuff anymore, but in theory, if we treat the root, of the problem, and I'm just reading your comments. If we get to the root of the problem, then we won't have the branch anymore. We clear it up, we support and balance the energies, and then you go forward and feel better from there. And what a beautiful idea now. I feel like we're all forced to have some introspection these days. I'm sure you, like me, have come up with a lot of revelations over these past few quiet days at home, relatively quiet days at home. And wouldn't it be nice if we could just take care of ourselves before we get sick, right? What if we could eat well and rest and quiet our minds to think what's important, what's not important, what do we need in our life? Which is totally an aside, huge aside. But the point, right? But the point is, Chinese medicine has been saying that for thousands of years. They have been saying that it's important to treat the root of the problem, so we can stay healthy. So, our practice, Michigan Associates of Acupuncture and Integrative Medicine, as you know, we're shut down now for 2 weeks, and we all miss you terribly. But we are still here for you, and we are still here for you. That's why we're doing these Facebook Lives. It's a way of interacting with you. And to interact with you directly, to answer global questions. If you want more personalized questions, we are still answering our phones. Please call us. We're answering our phones Monday through Friday, 9 a.m. till 4:30. We are happy to get in touch with you directly via telecommunication or phone or perhaps text. Please let us know how we can support you. As you know, Chinese medicine, acupuncture is an integrative holistic medicine. The point is how we feel emotionally is just as important to our health as what we're taking internally or eating or sleeping. So we want to be able to support you for that. We do it usually face-to-face with our acupuncture treatments. But let us help you. If you want some herbs, let us know. We've got tons of herbs in our office. Thank you. We've got herbs in our office. We've got tinctures we can send out. Please, ideally, let's help you before you get sick. Let's help you boost your immune system now before you have symptoms. Chinese medicine, being thousands of years old, has dealt with many histories of epidemics and pandemics. Right? Lots of internal invasions. We have a history of doing it. We have never treated this disease, but we treat symptoms. We treat based on what you see. So please let us help you. We're happy to do so. As I've said to many people, and I'll say it again, we're all in this together. I don't care who you are in this country, in this world, we're all in this together. So all of our acupuncturists at our clinic have history and experience treating this. Let us help you. That's what we do. This is our time. If anybody has any questions, please let me know. You can type them in right here. Is there a way we can post a link to upcoming sessions on our Facebook feeds? We do. We just sent out an email to our clients, but also on our Facebook page, there's a link of the upcoming Facebook Lives talks and who will be speaking. I'll try. Jordan is hopefully listening, and I think she can help us so that our friends can share our Facebook Live posts. But then if anybody wants to talk to us directly, that would be just calling into the office, 248-737-7126. You can also find that number on our Facebook page. And that's a good way to get in touch with us directly. So Please share this information with your friends. Yeah, that's Jordan. She'll share more information on individual events. So if you're a patient of ours, please keep a lookout in your email. We're going to be keeping in touch with you via email. And, of course, Facebook. Please let us know if anybody of our patients have ideas of ways that they'd like more support from us. Again, please let us know. We all, like y'all, are home and not doing anything, but we have access to herbs, and we're trying to get creative in methods of supporting you. Any other questions, please don't hesitate to get in touch with us. Email, Facebook, text, call. We're all here. All right, guys. Thank you so much for joining me. This was so much fun, and we look forward to seeing you again soon. Thank you for your patience with my technological and other difficulties. All right, have a good day. Be well, and take good care.